All right, guys. Hello. It's Wade. I wanted to just take you guys through a quick introduction rather to the course here. Just get back to my PowerPoint here. Share my screen. All right. Here we go. So, guys, welcome to HES 307 Techniques 2. So this is upper extremity techniques evaluation and rehab. And I will be your instructor. So let's just kind of dive right in here. All right, there we go. So ultimately, right, when we talk about the shoulder, we need to find a way to see things in a new light, right? In a systematic way, focusing on basic concepts and principles. So the shoulder itself is one of those joints, right, that many students and many young professionals completely and totally freak out over, right? Yes, it's true. The shoulder by nature is extremely complex. The upper extremity by nature is very complex. But if we break things down into component parts, and we become very fluent and we become confident and good at those basic things and at those component parts, we can become very, very good at evaluation and rehabilitation of the upper extremity, right? So ultimately, instead of attempting to try to kind of encapsulate, the shoulder, the elbow, the wrist and hand, all of that whole, we need to try to break it down and learn some basic principles that will allow us to, make some real progress and start to think like athletic trainers and start developing our clinical reasoning skills. Okay. And like we just talked about, so many people, particularly when it comes to, the upper extremity and really more so than anything the shoulder, become very, very confused. But one thing that I want to, make clear for you guys is that I want you to feel like you can come talk to me, right? If you have questions, all you have to do is come ask, right? So I want to be able to help explain things to you in a systematic way so that you can understand. So that hopefully we can minimize a lot of that confusion, because ultimately, if you don't really kind of start to develop an appreciation for a lot of the basic principles that we're going to be talking about, it's going to be a lot more difficult for you to make clinical decisions, if you don't have the basics down. And that really is the goal, right? I want you to be able to walk into your clinical experience, be able to, take a lot of the principles that we're going to learn, walk up to a patient and be able to do everything from A to Z, right? Whether it's, talking with Troy or another one of your preceptors on campus, maybe me, maybe Mary, maybe, another student. I want you to really feel confident here. So how do we do that though? How do we develop confidence, right? And the way that we're going to approach that in this class is we're going to really do our best to learn systematically. So we're always going to start off with the basics of anatomy and biomechanics, right? We're always going to learn the basic structure first, and we will dive deeper into those things, believe me, as we move through, the course. But anatomy, biomechanics, right? From there, we'll go into special tests, right? And once we've mastered anatomy, biomechanics, and special tests, then we get into making our assessment and developing our intervention. And when we do that, right, and we have those steps down, what that allows us to do then is to start thinking and making decisions, which is really what we want you to do, which is what I want you to do, right, when you're in the clinic with a patient. Okay. Now, as you start to learn the anatomy, learn the biomechanics, learn the special tests, okay, and learn how to make an assessment and create a treatment plan and make a decision based on those things, right, you start to learn a principle or something that that's been inculcated into your mind about how the upper extremity works, about how you might approach a certain problem. Okay, so what you have done is you've developed your own clinical practice principle. So what we want you to do is to keep repeating this process. Okay, anatomy, biomechanics, special tests, assessment, intervention, decisions, principles, over and over again, because it is in doing that you develop clinical competence. Okay, so repeating, repetition of that cycle, applying it to new contexts. Maybe just not, um, a student athlete at Gustavus. Maybe, maybe you're in an experience elsewhere. Maybe it's a guy working in an Amazon distribution center with a rotator cuff tear that you wouldn't typically see in someone who, in an athletic population. But doing that over and over again helps you develop that clinical competence. Okay, so here's the deal. Okay, I've been an athletic trainer for a fairly decent amount of time, right? More than a decade. But what if I were to tell you that me and you, okay, as students, right, and me as the instructor, what if we're all actually on the same plane as far as our learning, right? And let me move my talking head out of the way, that way you guys can kind of see here. I'm gonna put that right there. Okay, so we're going to just spend a second talking about, right, the Dreyfus model of adult skill acquisition. Okay, and you guys as adults are beginning to kind of learn differently than you did maybe when you were in elementary, high school, those types of things, right? So ultimately, in certain things and in certain areas, I am, above, the competent kind of area of learning, more towards proficient or expert in certain things. And in certain areas or skills, I may not be as proficient, right? I might be simply competent at those things. But for you as a student in this class, right, perhaps you're an absolute beginner. Maybe you don't know anything about, the shoulder, elbow, wrist, and hand. Maybe you've had zero contact or experience with that. Maybe you're starting as a beginner. You know maybe a few things, right? And a few maybe kind of rules, right? So ultimately, what we want you to do in teaching you these principles is we want you to develop a set of rules to work by, right? To become a beginner, right? And then move obviously on from there, right? And take those rules and then apply those rules to situations, okay? And then be able to do that on your own independently by your own self-formulated approach to the problem. That's how you become competent, okay? And as we talk more about kind of the components of this class, clinical, the assignments, quizzes, reading, all those types of things, but then also the scholarship part of this class, the CAT paper and all those types of things, it is there. And it's in those assignments that you're going to start moving away from the competent, right, milestone, which is where you really need to be by the time you graduate to take your BOC. But you start moving away from that towards becoming proficient, and then hopefully, right, aspirationally down the road at some point in your career, you'll become an expert, right? And it's scholarship that helps you move that direction. It's the CAT paper that's going to help you move that direction, because you're going to start to ask questions based on your own experience. Okay, so really quickly, let's touch on evidence-based practice. Okay, big surprise, right? What we talk about in class, all right, and the tests we teach you, and the information that we give you will, I can guarantee you, be different than what you are going to see, what you are going to hear downstairs in the athletic training room. I promise. Okay, you know why? The reason for that is that Troy and any of your other preceptors, right, any other athletic trainer on, that you work with, okay, has their own clinical experience to pull from. So the components, right, of evidence-based practice are the best available evidence, the experience of the clinician, and the clinical situation, or in this case, the patient presentation on this slide, right? And it's those things that combine together to form how evidence-based practice is executed. So if you see something done a different way downstairs than we do it in class, one thing to keep in mind is that it's that clinician's experience that is playing into how they're applying the evidence, right? Because I'm going to show you guys things in class that are going to be done completely differently, likely, from the way that you're going to see them done in the clinic. Doesn't make them any less valid, and certainly doesn't make the way that things are done by any of your preceptors less valid than what we learn in class. Okay, they are simply formulating evidence-based practice based on their own lived experience. All right. And then obviously one thing we're going to touch on as part of our assignments too is, patient-centered care, right? So how to talk to a patient and relay information to them, and how to consider their values and the treatment options and making the best patient-centered decision alongside them, right, as a clinician. Okay, so here's the deal, right? I am a big believer, and these are a couple of my former students that are both certified and out and practicing now. But guys, I am a big believer that athletic training has so many gifts to give the world, right? Especially healthcare in general. And I feel like so often as athletic trainers, we sell ourselves short, right? We don't think we're good enough. We think that just because there's another healthcare professional in the room, whoever they are, okay, whether it's a physical therapist, whether it's a physician, right? That because of the letters behind their name, that they know more than we do about a certain thing. And I'm going to tell you something, that is not always the case. I promise you. Okay. So ultimately, all of that to say is that I want to help you develop the skills in this class, develop the knowledge in this class, so that you can function as a healthcare professional, so that you can have the confidence to know that you are a medical professional, and no one can take that away from you. No one. And so how do we do that, right? How exactly do we go about building that professional identity in you, right? What we have to do, okay, is we have to give you knowledge. So we have to teach you the material, right? We have to help you get really, really, really good at skills. We've got to teach you skills, right? You've got to be able to, you've got to be able to not only have that knowledge and that skill, but you've got to be able to reproduce it in any different situation, right? So not only, should you be able to apply that skill, in the athletic training room, on the sideline at an event, right? But you should also be able to take that knowledge and that skill and carry that into any situation that you're in, right? So maybe you're doing a rotation over in primary care, and somebody comes in with shoulder pain. You should be able to automatically translate the knowledge and skill to that environment, right? And the more that you do that over and over again, your professional identity as an athletic trainer will develop, and your confidence as a clinician will continue to develop. Okay. But how do we go about teaching knowledge? Okay. One thing that I'm going to do my very best to do in this class, based on my experience, and I think this is extremely important because I think this is one of the missing pieces in our education as athletic trainers that we don't necessarily teach so much, and that's the spectrum of disease. So if you really think about it, right, whenever you're in class, generally speaking, you're learning about maybe only 1/3 of the disease spectrum. Okay, the slice of the pie that you're learning about is typically 14 to 30 years old. Generally, right? You're not learning about pediatrics. You're not learning about someone who is 82, has end-stage glomerular arthritis, and is having to have a shoulder replacement. I wasn't taught that in school, right? And so if we can introduce concepts about obviously development and then help teach you things and about pathologies that you'll see throughout the lifespan, it's going to make you that much more knowledgeable and that much more effective. Okay. So how do we take that in this class? How is that applied practically? Okay. Knowledge. All right. There's going to be readings in this class. Now, and I want to give you guys a heads up. This took me a lot longer than I expected, but I, for lack of a better word, completely and totally revamped the entire class. I know that the previous instructor that was here had the way that she did it. But, I've taken a lot of it and broken it down. And the syllabus may look a little intense for those of you that have already looked at that, but I'm going to explain that here in a second. So with our knowledge, right, we're going to have a lot of readings. We're going to have quizzes. there's going to be quizzes on Moodle pretty much every week on course content. And we're going to continue to try to work out a kink with, figure out KenHub. But if we can get that figured out, which hopefully we will be able to, there will be quizzes on radiographic anatomy. So one thing that you're going to learn, or at least be very well introduced to, if I have anything to say about it by the time the class is over, you will be able to read an X-ray. Okay, you're going to have some baseline knowledge on how to read an MRI. And those are things that we're going to try to really work on in this class. Okay, skill. All right, so skills. Obviously, we have certain days in our class that are labeled clinical intensive. What does that mean? That means that you come to class, right? I'm there, you're there, and you come there ready to practice your skills. You come there ready to learn skills, so come dressed appropriately for class to be able to spend the vast majority of the time doing nothing but learning and doing skills. All right. Your clinical experiences are important for developing skills, right? And then we will have regional practical exams in our class as well. All right. So the scholarship, it's a big deal, right? Your PICO question. So we're going to talk about that here in a minute. And also the CAT paper. And like I said, that is the thing, that project, right, is the thing that moves you, kind of away from not just being competent, but from becoming curious so that you can become proficient and move towards being, not only a leader and an advocate for your patients in the profession, but also start the journey towards becoming an expert at some point in your career, right? That's what it's for. Okay. So PICO question. All right. So the PICO question, this is a way of asking, right, of asking a question or trying to identify something that you are going to essentially research. Okay. So PICO, and you guys have probably done this already before, but the P in PICO stands for patient population. Okay. I stands for intervention of interest. Okay. C stands for clinical problem for comparative intervention. And then O stands for outcome. So there are different types of PICO questions that can be asked, right? So an etiology-based question. So an etiology means the cause of something, right? So for example, here's an example of an etiology-based question. In, collegiate cross-country runners, there's our patient population, okay? Does barefoot running versus fully shod running contribute to the prevalence of medial tibial stress syndrome, right? So there's a question there, right? Obviously, diagnosis-based question. You could say in, collegiate offensive linemen, right? How many of those with that, for example, do not brace, that potentially don't wear prophylactic bracing during the season versus those that do? How many of them have ligamentous laxity on exam, right? Without a history of injury. Okay. Obviously, prognostic-based questions fall along the lines of, as essentially recovery from injury, return to play, right? So, for example, in volleyball players with patellofemoral pain, do those that undergo quad strengthening only versus hip abductor strengthening and quad strengthening return to play, right, or full activity quicker than those that just underwent quad strengthening, right? One that I don't think we pay as much attention to, but I think is really, really important, is a meaning-based question. So the meaning-based question is really something that explores someone's lived experience of a problem. So let's give you an example of that. And let's say that in dancers, for example, that have had a diagnosis of disordered eating at some point. For those that have sought, intervention and or maybe counseling or working with a medical provider, how has that experience impacted their recovery, right? Or their ability to continue to stay active despite that mental health concern and that pathology, right? And so exploring their lived experience, right? Maybe even if it's an area that we don't know a lot about, exploring kind of a meaning-based question like that will allow us to develop a base, right? A verbal base based on someone's story of how to study something, because um, now we have what someone perceives something to mean, right? Based on their answer to a meaning-based question. So let's just go. I'm gonna stop sharing real fast. I'm just gonna go to the library real quick. I'm going to show you, we're going to go through just some examples of, how to potentially kind of phrase questions when you are kind of searching for these things. And you guys have probably done this already. But let me just kind of take you through. Okay. So for example, let's say that we want to try to, look at the rate of ankle sprains in those that brace versus those that don't. Okay, so for example, if we want to include both the terms and we want to be very specific, okay, ankle sprain and brace in our search, okay, here's a way that we might do that. So we're going to go to our search bar here in the library and ankle sprain, and I want to include, I'm being very specific, and bracing. Okay, got 98 results that popped up there. Okay, now remember, okay, and is really kind of bring in more of a specific search for us. However, let's say that I wanted to be a little bit more broad and include results, regarding ankle sprains and or bracing. Okay, I could go ankle sprain or bracing. Look at the difference. Okay, I have 8,500 results compared to 98. So much more. So in my results here, you can see that I've included both terms in the search. Okay, so obviously you guys can come and chat with me at any point. We can talk more about kind of how to search for things if it's something you feel like you need help with. But I just wanted to demonstrate that for you. Okay, the difference in and versus or, right? And you can even be more specific, right? So let's even get a little bit more granular. So we're going to go ankle sprain and bracing and return to play. I've gotten a lot more specific here. So let's see what we get. Three results. Okay, so the more limiters we put on a search term and the more specific that we get in those search terms, that narrows the results even more. Okay, so let's dive into the syllabus here real quick. Okay, actually, before we do that, speaking of the PICO question and the cat paper, so let me show you guys this. Okay, this is Moodle, obviously, for our class. All right, let me show you what's been posted so far. Okay, so I've got obviously the syllabus link here. Okay, now what I've done for you guys as well is I've given you guys some guidelines for your cat paper. Okay, these are the abstract guidelines for the cat paper, and that is here in Moodle. Okay, under the announcements tab. Let me get this to open up here. I'll have to reshare. Right. Okay. Here it is. Okay, so I'm giving you guys just an outline of the abstract. So for your cat paper this semester, when you turn that into me at the end of the semester, you'll have to have not only the obviously the full paper, but you'll have to include an abstract as well. So the abstract as well as the manuscript. I'm going to want both. Okay, so I have obviously a template for you of what the abstract should look like, some guidelines here. Okay, the other thing that I have for you, I also have given you an example of a cat paper. This is one that I wrote during my doctoral work. And so this is one that I'm actually still working on publishing, but this is an example of what a cat paper could look like. Okay. And I've got that posted here for you. Happy to sit down with you guys to go over any other examples or, look at or, continue to kind of explore this to kind of help put you at ease. Okay. Because this is a big part of the class. And it's something that I want you to be really comfortable with because I'm expecting very good work from all of you on this assignment. Okay, so let's go now back to the syllabus here, and we'll finish up with this presentation. Okay, Moodle, here we go. All right, guys. So this is Moodle for the class. Let me pull up the syllabus real fast, and we'll work through that. Sorry, it's taking a little bit to load. Just pulled it up here in Google Docs. Okay, here we go. So here is the syllabus for this course. Okay, so a couple things. We will meet. So the generally speaking, the month of September is a little nutty for me personally. So the way that the schedule is laid out is we're going to meet Monday, Wednesday, Friday in person. Tuesday, Thursday will be virtual, right? However, that's going to be that's not really going to be set in stone until probably more like October. So the dates will be a little different. Okay, so you can see, let me explain that. If we scroll all the way down here, we're going to have 4 different types of days in this class. Okay, asynchronous, meaning that I post things on Moodle for you guys. Okay, and everything is there for you ahead of time. You don't have to come to class that day. You don't have to log onto your computer. You can sit there with a cup of coffee or whatever it is that you want, right, and go through the material. Okay, classes that are in-person didactic. Okay, that means that we will meet in 209, right? I might lecture a little bit. We might do a little bit of skill practice, but it's going to be us together in class, lecture, maybe a little bit of hands-on. Okay, days that are termed clinical intensive. What does that mean? Okay, days that are clinical intensive means that we are going to be very, very focused on skill practice that day. We're going to be doing things. We're going to be learning special tests, goniometry, palpation. So if we are doing, if we're having a clinical intensive day, come to class, appropriately dressed, so that you and your classmates can work on palpation, tests, those types of things. So just make sure that you've got the appropriate clothing on to be able to do that. Okay. So that pretty much covers the types of days, right? So there's 4: asynchronous, in-person didactic, clinical intensive, and then online didactic. Online didactic is where we actually will meet as a class via Google Hangouts or Zoom, and we'll actually physically get together and chat and have class online. Okay, a couple things. So I don't know how many of you guys have the Trail Guide workbook. There are some assignments here there that I want you to do. A quick note, okay? If you see over here the assignment and it's not bolded, that means you don't have to turn it in, okay? However, here's the difference. If you look over here on the right side and you see that something is bolded, okay, that means that it's something that you have to complete and turn in. All right. Obviously, I want you to use the workbook and work on the anatomy that way as well. But if it's bolded, that means that you're turning it in. All right. Um, on the readings here, okay, we have, I really tried to break down. I know I looked at the syllabus from last year, and the readings were just, quite frankly, particularly for the level of complexity for the upper extremity, it was just too much. So we've broken that down for you. You can see that, for the 9th. So that's the first day we're going to be meeting together in person. You've got a 7-page reading from Starkey, and then you've got, just a trail guide reading. It's like 20 pages, but that's it. The next day for that clinical intensive, literally 1 page in the trail guide. So my hope is that by breaking up the readings and making them a little bit more digestible, just realized. Sorry, guys. I just realized that I wasn't sure. Apologize. Let's see. Sure. Okay. So, really quickly, guys, sorry about that. So we talked about the different types of days: asynchronous, in-person didactic, clinical intensive, online didactic, right? And what those mean. Okay, we've broken down the readings for you here, made them a little bit more digestible. Obviously, all the bolded assignments are the ones you turn in. The ones that are not bolded, you don't have to worry about turning in. Okay, let's talk really quickly about a couple of assignments that are unique. So the clinical diagnosis and documentation assignment, what is that? So that is an assignment, okay, where you are actually, based on a history, you are essentially doing a full exam on a patient, right? And based on the history, based on the clinical scenario and your examination findings, you are actually going to give that patient a diagnosis. You're going to turn that into me, right? Now, a couple things there. I would prefer, if this is someone that you come across in your clinical experience, that's the best scenario ever, right? In the event that you feel like you need, a prompt or something for this assignment, I can provide you a prompt, but I would very much prefer that this is someone that you're, caring for in your clinical assignment. So this assignment, though, the clinical diagnosis and documentation assignment, that's just really the first part of this. Okay. For the rehab portion of this class, okay, you'll see that we also have a rehab and treatment plan assignment that will go along with that same case. So after you diagnose the patient, right, now it's your responsibility to come up with a treatment plan for that patient. Okay. And I will post examples of what those look like before, obviously the first one is due, just so you can kind of see what that's supposed to look like. Okay. Quick word on the quizzes. Okay. I know it looks like there's kind of some stuff jammed in here pretty close together, but the quizzes, guys, if you look at the point value for the quizzes, they're 10 points a quiz, right? And those quizzes will never be more than 5 to 10 questions. So if you've done the reading and you've studied, these quizzes should literally take you 5 minutes. Okay. So these quizzes are not meant to be a burden on your time. I really want you obviously focusing on the clinical diagnosis and documentation assignments. And I also want you focusing on the rehab assignments and the CAT paper. Those really are the big chunks. And then studying for your tests and working on skills. Okay. So, the crazy thing is that with this class, I know it seems like a lot, but we're actually only covering, in Starkey, we're only covering maybe 3 chapters. And then in Hoagland, for the rehab portion of the course, we're really only covering about 3 chapters as well. Okay. Now you'll notice here that after we get, down past Thanksgiving break, we have essentially finished a lot of the clinical, kind of the clinical part of the course, right? And we're going to be shifting gears to really, doing nothing but skill review, right? And really doing, having discussions on kind of current topics like NATA position statements, the CAT paper, those types of things. That's going to be the focus for the last few weeks of the course. All right. So as far as points and those types of things. Okay, let's go through that just really quickly. So you'll have exams. You'll have 4 exams in this class, 4 unit exams. They'll be 100 points apiece. Okay, you will have 1 comprehensive final for 100 points. Okay, you'll have regional practical examinations. So we'll have a practical over the shoulder, we'll have a practical over the elbow, and we'll have a practical over the wrist, hand, and fingers. Okay, those are going to be 30 points apiece. But to cut for grading purposes, I'm going to build in just a little bonus to those to where those 3 combined will equal 100 points. Okay, your competencies. Okay, you've got 4 competencies that you'll need to turn in student sign-offs. Those are 10 points apiece for a total of 40 points. Preceptor sign-offs for a total of 30 points times 4, that's 120 points. The quizzes, okay, 10 points apiece. The Moodle quizzes, okay, 10 of those for a total of 100 points. The Ken Hub quizzes, 10 points, 10 of those for a total of 100 points. All right. And then the assignments, clinical diagnosis and documentation assignments, 50 points apiece times 3. The rehab and treatment plan assignments, 50 points times 3. All right. Obviously, the rough draft of your CAT paper, you'll have to turn that in. That's worth 75 points. You will turn in, obviously, the final draft of that paper. That'll be worth 100 points. And then I don't know if you guys have done this in the past, but I have built in time. All of you will be presenting your CAT paper to the class with a PowerPoint, with everything. So you will actually be giving a presentation of your paper to the class. And that'll be worth 25 points. Obviously, your clinical experience is factored into your grade. Okay. It's all here. In the event that you're not meeting expectations with your clinical experiences, that will be reflected in your grade. Okay. Obviously, make sure you're getting all of your professional development done. So all of these things factor into your grade, and it's all laid out here for you. All right. So, guys, that's pretty much it for the class. If you have any questions, please let me know. Okay, and I'm more than happy to answer any questions that you might have. I'm looking forward to learning together, guys. It's going to be a lot of fun. We're going to learn a ton, and I'm really looking forward to it. Okay, we'll see you guys on Thursday.